Approximately 100 million women, as we speak, around the world take oral contraceptive pills to manage their menstrual symptoms, to manage birth control, and to manage acne. What is a oral contraceptive pill? And if it really works, why do we still have acne? Is the first question you should be asking your doctors. Number one, oral contraceptive pills is nothing but a synthetic form of a hormone, estrogen or progesterone, that our bodies naturally produce. Now, hormones are great. It is a thing on which our life is dependent, our body is dependent. It is the reason for the communication between trillions of cells inside the body. But when you put something synthetic inside the body, when you put something that is artificial, it doesn't really help, and it will always have side effects because it's not natural and the human body does not know how to cope with this. I can't tell you the number of people, the number of women that I see. I have been a victim of it once in my life, so I know how it feels. And if the OCPs did really work, why do we still get acne? Why do you have to stop the course and then be on it again and then you leave it and then the acne comes back? Because that's not what the root cause is. So I've already talked about this analogy, and it's like a patient walks in and he says, hey, I have a wound in my left hand. My left hand hurts. And the doctor says, okay, let us put the plaster on the right hand because it's still hand. So let's just see how it works. 2 weeks down the line, 3 weeks down the line, 4 weeks down the line, nothing works. Maybe the plaster is on the hand, but that's not where the issue is. So you can just mask the symptoms, but the issue and the root cause is still underlying inside the body. And it's very important for you to remember that symptom is not a disease. So if you get acne, if you have PMS, if you get bloating, if you are constipated, especially around your menstruation, it is a sign that there is something wrong with your hormonal balance. There is something wrong with your hormones. Your body is just not in its real homeostasis, and the actual balance of the body is just all array, and that is why you have these symptoms. So a lot of people think that, oh, I just have menstruation cramps and I will just take 2 pills and I will be okay. I'll take a Meftal and I'll be fine, and I am having these pills and I'm going to be okay. It doesn't work like that. If that pill is working, why do you get the pain back again? If the pill is working, the pain should be eradicated, but it's not, because you're putting it at the wrong place and at the wrong source, and that's not what the problem is. The problem is inside your body. The problem is with your hormones, and when you put something that is synthetic inside of it, you are not helping. You are actually increasing the load on your body, and now it has to work double or even thrice the more actual work that it can do, and it's just exhausted. No wonder everyone is hormonally imbalanced. How many times do you feel angry and you're like, just don't talk to me, I just don't feel like talking to you? Or you just have these emotional mood swings and you just do not know what to do. I'm not saying every time that you face this it's because you have hormonal imbalance. Sometimes it's very natural for you to feel that way, but most of the times, if you are on a pill and if you have hormonal issues and if you are taking birth control pills for your acne, it's going to have these side effects. It's just a side effect. The number one thing, there are so many side effects to these OCPs that a video is not going to be enough, but something as simple as when you are on OCPs, it depletes you of your full vitamin B profile, especially your vitamin B6 and your B12. Now, vitamin B12, it's crucial. Every second person is walking around with low vitamin B12 levels, and vitamin B12, you lose it. The more stressed you are, the more you lose it. The more stressed you are, the more you lose it. It's a water soluble vitamin. You lose it with excretion, you lose it with urination, you lose it with sweating, and you have to make sure that you are replenishing it every single day by the food that you eat or with supplements. A lot of people don't do this. You get deficient in zinc, you get deficient in magnesium, you just lose the basic vitamins and minerals that we need, and all of these nutritional deficiencies then leads to early graying of hair, or you have skin issues again, or your body starts reacting. You just have all emotional hormonal imbalance, and it comes from the fact that you have never looked at the problem that actually was there, and you have just started a symptomatic approach that is, oh, I am having acidity, let's take an antacid. I am having constipation, let's take a laxative. I have this problem, let's just do this. Oh, I have pain, let's just pop this supplement. I have period cramps, let's just take the supplement. I have sugar cravings, let's just eat sugar. You have to understand, when you get a craving, especially for foods like junk food, processed food, high fat food, high sugar foods, high refined carbohydrate foods. What you are doing is actually you're feeding your poor gut bacteria. You are feeding something. So when your body is asking for sugar and you give it sugar, the bad bacteria feeds on it and it divides and it multiplies, and now you will need more sugar. So is the solution eating more sugar, or is the solution cutting down the source on which your poor gut is being feeding on? So it's very important that you give your body the basics that it needs. So having orange juice, that's not nutrition. And just having broccoli soup and spinach soup and all of the greens and vegetables and leaving out the carbohydrate, leaving out proteins and fat, not having ghee. Fat is so important when it comes to your hormones. It's the number one thing that we do when it comes to hormonal imbalance. We add fat. We add fat when it comes to increasing or just bettering your hormonal communication inside the body, and it works like magic. So this does not mean that you start eating ghee all throughout the day and you're just sitting all day. Even that doesn't work. Everything has to be done in moderation. Just popping a pill for every issue that you have is easy, is convenient, but it's also very, very short term, and it always comes bearing side effects that you have to go through, that your body has to go through, that your mind has to go through. And you always have to remember these things creates inflammation inside the body. So when you get yourself tested for C-reactive protein or your ESR levels and it's just above 5, above 3, you have to know that there is systemic inflammation going on inside the body, and you have to fix it before it's too late. How do you do it? It's not about starting to eat anti-inflammatory foods. All of our nuts, seeds, whole grains, vegetables, everything is anti-inflammatory in nature. So when it comes to food, there is no such thing as neutral. There is always either it's good for you, either it's going to increase the inflammation, or it's going to take care of the inflammation. Something as simple as not eating and just fasting is also going to help you decrease the inflammation inside the body. And a lot of times, I've talked about this in my healing crisis video as well, but sometimes when you're fasting, your acne could be aggravated, your acidity could be aggravated, your constipation could be aggravated. When you change your diet entirely, things could come out in a much stronger way and a much harsher way, but they come out to leave. So I always use this analogy for a lot of my patients as well. So let's say when people start meditating, they start feeling more uncomfortable, more uneasiness, and then there's just so much of thoughts. I don't know how to deal with my own mind. I just want to stop it. I just don't know what to do. And what is actually happening is, so you have to imagine that there is a drum. There's a big blue drum, and it's filled with water. Now this drum is your body, and this water is your thoughts. It's your mind, it's your body, and then there are thoughts inside of it. Let's say there are leakages somewhere, so you have these certain bouts of panic attacks and anxiety and stress and worry. That's completely okay. Now what is happening when you're meditating is you are actually sitting down with the pain that you have. So of course it is going to be aggravated. So I've just taken a knife. This meditation is a knife. You put it on the drum, you just put a nice big hole, and now all of the water starts thrashing out with a force. So initially it was just a leak. So it was here and there and you didn't really observe it. But now that you have started meditating, it comes out with such force that you are like, okay, the meditation is not working, I am feeling more uncomfortable. But you have to remember, just because you have some pain, just because a joint in your body is aching, or just because you have tears in your eyes, or just because you have a vaginal discharge, white discharge and everything, it is your body's way of getting rid of things it does not need. And you should not hinder this process. When it comes to meditation, when you do feel a lot emotional, that's not the time to leave. That's the time when you need to sit down and you need to meditate more. If you don't have time to meditate, you need to do it twice in a day. That's the basic simple rule. And initially it is going to be tough. So let's say you have been on OCPs and you suddenly stop taking it. Of course you're going to get a lot more acne, because you were just suppressing the symptoms by using a synthetic hormonal pill, but it's not helping. The minute you stop it, you're going to get back your acne. And how long do you think you're going to be on that? When it comes to OCPs, how does it work? It's not only just damaging your skin cells and not letting the acne come out, or just taking care of the sebum. It's also at the same time damaging your liver cells. It damages your brain cells. And do you even wonder, why do you have brain fog? Why do you not have attention? Why can't you remember things? Why can't you just be energetic and be in good mood? Your brain cells are dying With every pill that you take, your liver cells are dying. Yes, it regenerates, yes, it grows and everything, but there is a threshold. And as soon as that threshold is crossed, that's when you see diseases. So PCOD, thyroid, it's like a joke. I have cold and cough. That's how people say I have PCOD, I have menstrual issues. It's not a joke and it's not funny. People have to start looking into this. Oh, I have a bloating here and there. Oh, I'm constipated sometimes. It's not normal. It's not normal to eat a meal and take a dump all the time. It's not normal to not take a dump. It's not normal to take dump 4 or 5 times in a day. It's a problem. Everything has to be in a balance. Your body works at homeostasis and it is going to do its best to bring it to balance. It could be with pain, it could be with inflammation, it could be with fever, but you always have to make sure that basic lifestyle changes such as breathing, it can decrease your inflammation. Sleeping, of course, it can decrease your inflammation. Eating correct foods, eating at the correct time, sleeping at the correct time. It sounds so airy-fairy, but this is what works. This is what has always worked. The more detached people are from this thing, the more there is going to be suffering. The more we are going to have to be dependent on pills, because all of us put belief in, oh, I'm going to visit a doctor and she's going to fix my skin. I'm going to see a dietitian and she's going to give me a diet and I'm going to be okay. That's not how it works. There is one thing where you need to put all of this belief and energy that you have, and that's your own body. A lot of us don't do it because it's too easy and we like complicated things. But let's try to make it easy one more time, and let us just put all of this belief that I have, that a dermatologist is going to fix me, or a gynec is going to fix me, or Ankita is going to fix me, or a dietitian is going to fix me. Let's just get out of this hoax. Let's just come back to myself and let's just try to do things, provide my body with the basic fuel, and let's see how my body responds. And I promise you, 10 out of 10 times, I'm not saying it's going to get better. I'm not saying it's going to get perfect. I'm saying it will get better, and it always gets better. The minute you get out of the way of the body and you let it do its job, it always knows how to heal, and it always gets better until there is a trigger that just puts everything around. So you have to take care of your stress, your sleep, your food, your movement, your rest, your thoughts, your energy, your emotions, everything. And I know it is so repetitive, but still people don't remember this. So this is one thing that works, and that is just taking care of all of the things, and your body can deal with food. Your body can balance hormones. Your body can decrease inflammation. It can do it if you allow it to. So you sit down and see, what have you been doing wrong? Where have you been putting all of this wrong faith? Come back to yourself. Put all of these beliefs inside of you. Put all this energy that you have in a dietitian or on a pill. Bring it back to you and say, I know my body is going to heal. I know it's going to fix itself. I know I'm going to be okay. I know I'm healing. I feel light. I feel great. I feel powerful. My skin is getting better. I can feel it. I can feel it. I can feel it. Say it until it becomes your truth, and see how well your body is going to respond. I promise you, you're not going to regret it, and this will not have any side effects. This is sustainable and it's long term, and you don't even have to put money out there. So you make a decision. Have a great Sunday, and please take care of yourself.